Welcome to Maestro Conference. Please enter the conference PIN number. This call may be recorded. Thank you. You will now be connected.
Good afternoon. This is the 2-minute warning. Please press 1 to ask a question.
Good afternoon, everybody, and thank you for joining today's briefing on COVID-19 in North Carolina. As of today, we have 41,249 lab-confirmed cases, 1,768 new cases reported today, a new high, 760 people in the hospital, and sadly, 1,092 deaths. Dying from COVID-19 or mourning a loved one who right now can be isolating and difficult. We're really praying for all those who are suffering now. And today our concern is growing about the increase in cases and hospitalizations in North Carolina. This is also happening in many states across the country. While our hospitals still have capacity, we know this can change quickly. So we're working with hospitals and tracking hospitalizations and ICU beds closely. Today is North Carolina's highest day of new cases since the pandemic started, and it's also the highest day of testing that we have had, with over 21,000 tests reported. But the high number of new cases is not just related to more testing. These numbers show the disease is spreading and that more people need hospital care, and this has to be taken seriously. In the last week, we've done an average of over 15,000 tests a day, and this is a high number and it's good, but we know we still need to do more. Testing is available all over the state, but we're specifically targeting historically marginalized communities and other high-risk populations. The state is also working to surge testing to hotspots as those needs emerge. We also know that when you've been in a crowd, your risk of contracting COVID-19 increases. This is particularly true when many are not wearing face coverings and there's a little social distancing. So we recommend that anyone who's been in a crowd get tested, even if you have no symptoms. Today, we have an update on our key metrics from Dr. Mandy Cohen, our Secretary of North Carolina's Department of Health and Human Services. And I'll hand it off to her now to make her presentation. Dr. Cohen?
Thank you, Governor. It's day to day for those of you who like graphs. So we are now 3 weeks into phase 2, and as I said earlier in the week, I am concerned about our COVID-19 trends. North Carolina is not alone. Many other states are seeing increases in COVID-19 cases as well, and this virus is still a serious threat. We've seen in other states how a stable situation can quickly become anything but. So as I walk through the data today, you'll see that unfortunately, it's been another record-setting day. As a reminder, we look at a combination of trends that guide our decision-making. That includes COVID-like syndromic cases, lab-confirmed cases, positive tests as a percentage of those total tests, and hospitalizations. These subset of metrics are chosen based on public health data and White House guidance. And we can't look at any one of these metrics in isolation. We really need to look at them as a whole package when making decisions. And each one of them has limitations. Let me go through them now. On this first graph, we look at people who come into the emergency department with COVID-like symptoms. This metric serves as an early detection mechanism. And looking at the yellow line, you can see there is a small uptick at the right-hand side of that graph, which represents this past week. As I look to the next graph, these are our laboratory confirmed tests. Again, I draw your attention to the yellow line. You can see there's a fairly sizable increase in new lab confirmed cases. And as you heard from the governor, today we have seen the highest number of positive cases at 1,768 new cases, which you will see that top blue dot on the right-hand side represents that high record number. We've now seen 4 days with cases above 1,000 in just the last week. We are also setting records on the testing side done each day as well. And as a result of this record high amount of testing, we did expect this number to go up, but it's the pace of the increase that is concerning and shows us that this virus is still very much present in our communities across our state. I'm going to zoom in now. This next graph shows the exact same data I just showed on the last slide of lab-confirmed cases, but now, again, zooming in for a slightly closer look. This graph shows data since May 1st and not all the way back to March, so you can see it in a little more detail. So looking at the yellow line, again, it's a 7-day rolling average. This metric is trending up, and you can see it's accelerating as the slope of that yellow line is becoming steeper in the last 2 weeks. Now moving on to the percent of tests that are positive. This metric provides an important context for our number of cases. I want to draw your attention again to the yellow line, and you can see the percent of total tests that are positive have been just slightly increasing, and today is at 10%. But if you look at that 10% in the context of our nation, our percent positive is now one of the highest amongst states in the nation. We'd like that number to be closer to 5%. Our next metric here is about day-over-day hospitalizations. Again, the yellow line shows that North Carolina's trajectory of hospitalizations is rising. Yesterday was our highest day of hospitalizations with 812, but our hospitals still have capacity, as the governor said, to meet the increased demand if more people become seriously ill. But this continued rise in this metric is concerning. Finally, an update on testing. Looking at the yellow line, you can see that daily testing really is trending up, and we continue to make significant progress in expanding our testing. Over the past month, we've tripled our testing from about 5,000 tests on average today to 15,000 average tests per day right now. Yesterday was our largest day of testing with more than 21,000 tests completed in one day. All right, putting that all together, where are we? First, surveillance data shows that slight uptick. Gets a yellow line. North Carolina's trajectory of lab-confirmed cases does continue to increase and is accelerating. It gets a yellow X. North Carolina's trajectory of percent of tests returning positive has increased slightly over the last week, and so this gets a yellow line. North Carolina's trajectory of hospitalizations also slightly on the rise, and this trend gets a yellow line. We also track critical capabilities. We look at both our trend metrics, those that I just shared, as well as our capability metrics, meaning our ability to respond to this pandemic. And our ability to respond is where we really see positive trends and a ton of work that has gone on. First, as I've been saying, testing has had an upward arrow as we've been averaging more than 15,000 tests a day. We have more than 450 sites listed on our website, plus additional pop-up testing sites that folks can go to. And our RFQ for additional test sites purchased from the state government just closed, so we will soon be able to surge even more rapid response testing where it's needed in the state. We've hired more than 250 contact tracers to bolster our efforts of our local health departments and are in the process of adding even another 200 to meet the ongoing need of our local health departments. These COVID community team members reflect the diversity of the communities they serve, and more than half are bilingual. More than 1,100 local health department staff and community team members have completed state-led training on contact tracing, and our PPE supplies continue to be stable. We have enough critical supplies on hand to fill requests for at least the next 30 days, so capacity looking good. We have those tools to respond to this crisis and slow the spread of the virus, but we all have to work together on this. We can protect our families and neighbors. We can rebuild our economy. We can look forward to our children returning to school, but we must all do our part to make these things happen. First, we must all practice the 3 W's. Wearing a face covering, wait 6 feet apart, and wash your hands frequently. These easy actions have huge impact, but each person needs to do them for us all to benefit, and do them consistently, every day, every time. So this weekend, if you are leaving your house, make sure to grab that face covering before you go. Wash your hands every chance you get, and make sure to stay 6 feet apart from others. Second, if you think you've been exposed to COVID-19, get tested, even if you don't have symptoms. If you attended a mass gathering or a protest, get tested. If you work in a setting of high-risk exposure, such as a grocery store, a child care program, or a restaurant, get tested. If you work in a high-risk setting like a food processing facility, get tested. Third thing we can all do, answer the call. The local health department staff and other COVID community team members are reaching out to people who may have come into close contact with someone who tests positive for COVID-19. The team will connect them with important information and support to make sure they can get through this time. We continue to do our part to respond to the crisis. We continue to strengthen our testing and contact tracing infrastructure. Because we were aggressive and took early action, we bought ourselves valuable time to build that capability so that we'd be in the best position to be able to responsibly ease restrictions. We can now draw on these capabilities, but if we all do our part, we will not overwhelm them. Early on, North Carolinians came together and proved we can flatten the curve, and we can do it again. Remember, we're all in this together. The actions that we all take right now will help protect our friends, our families, our neighbors, and will save lives. Thank you, Governor.
Thanks, Dr. Cohen. I really want to thank you and your team for the hard work that goes into presenting these numbers to us. Relying on the data in science is critical. I know that we came into this making it difficult to gather all of this information from all over the state, and you guys are doing an amazing job putting it together and synthesizing it. And one thing I just want to make sure that, I know you know this, but the trajectory of cases was a red mark, just like the graph showed. I think you said yellow by mistake, but I just want to make sure they understood that the trajectory of cases was a red X here today. And I think as a state, we have taken important steps to slow the virus, but those numbers and trends are sobering. And I understand that people are anxious to get back to normal. I am too, especially as school ends and summer begins. And with more stores and restaurants and businesses open, people are leaving home more to get out. But everyone should remember that North Carolina is still under a safer at home recommendation. Just because we can leave home doesn't mean we always should. And the places that have opened with new safety rules, thank you for the extra work that you're doing to clean and distance for your customers and wear a face covering. Keep up that good work. It's going to be good business for you too. We'll continue to use caution in our stages of easing restrictions, keeping our people's physical health foremost while also strengthening our state's economic health. Easing restrictions gradually has kept the disease from overwhelming our hospitals, and we must keep that as a priority in our decision making. This increase in cases that we've seen doesn't mean that we've made a decision about going into phase 2.5 or 3. Insisting on the strategies that reduce transmission, like washing hands, wearing a face covering, waiting 6 feet apart from other people, and tracing the virus to its sources. Those are the things that we want you to do so that we can make these decisions in a positive way. And the most important reopening is our schools. Even as we celebrate graduates this week, I expect to have our children back in the classroom in just a few months. The hard work that we do now will make that happen safely. I know people are tired of this virus. It's been hard on everybody, but it's still deadly, and we cannot let our guard down. Slowing the spread is up to every one of us, every time we leave home. So practice those 3 W's. Our numbers aren't where we want them to be, but it doesn't have to stay that way. It's going to take all of us doing our part, but North Carolinians know how to work together and to defeat it. Along with Dr. Cohen, with me today is Emergency Management Director Mike Sprayberry. Karen Magoon and Nicole Fox are our sign language interpreters. Behind the scenes, Josiah Melendez and Jasmine Mativier are our Spanish language interpreters. And I see now we all also are joined with our Secretary of the Department of Public Safety, Eric Cooks. We'll now take your questions, and if you can identify yourself and your organization, we would appreciate it. Thanks.
Our first question is from Michael Hyland, WNCN, CBS 17.
Hi, Governor. This is Michael Hyland from CBS 17. I want to ask you first, with all of the numbers you've just laid out, can you go into more detail about how this is influencing your thinking about moving the state into phase 2.5 and even into phase 3? Is anything off the table at this point based on what we saw? And also, how is this impacting your decision about whether you will sign the bill that the General Assembly passed this week to partially reopen gyms and bars?
Thank you for that question. We are looking at all of this science and data to make decisions about a potential 2.5 or a phase 3. And we're looking at it over a period of time, and we are looking at the trends. There has not been a decision made about either one of those at this point. Neither one of those phases is off the table here. We will review that legislation. Obviously, we would rather do it through executive order because I think that legislation makes the process much more clumsy and much more difficult to change in the event that we would need to reinstate an executive order. But we're going to review that bill, and we'll let you know what we do with it when we make that decision. Thanks. Next question, please.
Our next question is from Vanessa Rufus with WCNC.
Hi there, this is Vanessa Rufus with WCNC Charlotte. Thank you so much for taking my questions. I have 3. They're all related to metrics. I wanted to know how reflective is the current testing and percent positives that we're seeing of the general population? So are we seeing these higher rates as a result of targeted testing in at-risk communities, or is this reflective of the general population of the state? My second question is, the other day and also today, you also mentioned, Dr. Cohen, that the state has one of the highest percent positives in the U.S. We know that North Carolina has not opened as quickly as some other states. I think that metric is so high. And then finally, hospitalizations, we know is a concerning metric as well. We also know that hospital beds can be surged to meet the needs. So what's the threshold for this call to surge or any further action to be taken with hospitals? Thank you.
I'll let Dr. Cohen give her analysis of that data and those questions.
Sure. Thanks for that thoughtful question. And it's the questions that we ask of the data as well. So we have been surging our testing. We continue to have testing criteria that is focused on people with symptoms, but also with exposures. And this week in particular, we have been sharing with you, we want folks to get tested who have been at a mass gathering or a protest at some of the higher risk job sites, as I mentioned in my remarks. So I think what we're seeing in our testing is a combination of both symptoms and exposure that people have. And that's a good thing. It means that we are targeting our testing to people who are more likely to be positive. So when I see that percent positive, I think that we are targeting to groups of folks that are more likely to be positive. However, we know we want to get to a level of testing that does drive that percent positive lower, so that we make sure not just that we are targeting those specific people who might be positive, but we are really casting a wide enough net. So that's why we are going to continue to ramp up our testing even further. So we're not done here. And in particular, we're going to be focusing, as I've mentioned in earlier remarks this week, on some counties where we're seeing a more rapid increase in the number of cases. We want to surge capacity in some of those counties as well. So we know that there's more work to do on the testing side there. As far as hospitalizations, those are trending up, and it is something we want to very much keep our eye on. But you can also see from our dashboard, we do have capacity in our hospital systems. I think ICU beds is the thing we watch most closely. We know that is a smaller resource for us as a state. There's a smaller number of ICU beds total than there are just other hospital beds. So we watch that closely. I'm in close contact with the leaders of our large hospital systems that have the majority of those ICU beds. I was just on a phone call with them earlier today to get their input on where they see, how they see things close to the ground. And obviously they are seeing those trends as well. But what I would say is they have said, we feel that these months in which we've been able to build our capabilities that I talked about earlier, right, building our ability to have PPE, building our capacity around testing, building our plans for surge, that puts us in a better position to respond. Again, these are concerning trends, and there are things that we can do to continue to slow the spread of the virus. But we need to make sure we're doing those actions now, right? That the actions have to come now in order to avoid overwhelming our hospital systems 3-4 weeks to come in the future. So that's why we are raising our concern level now to make sure that we take all the actions we need so that individuals who are out there, again, face coverings, washing your hands, waiting 6 feet apart, those are going to be the individual actions and the actions businesses that can take right now, today, that are going to help us slow the spread of the virus and not overwhelm the healthcare system so that we see that hospital rise. We hope to see that level out. Thank you.
Thank you. Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the NNO. Thanks for taking my questions. I wanted to find out, I know you said you haven't made decisions on phase 2.5 and 3. Is June 26th still a planned date for a phase, even if specifics aren't ready yet? And then on a different topic, the vetoed state budget last year was $2.5 million for the African American monument on the Capitol grounds. Now that money isn't in the budget coming forward, is there money somewhere else in another agency that could fund that? And do you think the process should stay as it is for removing Confederate monuments at the Capitol and government property?
The first question, I think, had to do with phase 2.5 and phase 3, and we have not made decisions on that, and neither of those are off the table, nor is it off the table that we might go into phase 3 as scheduled. We're going to look at the trends and the data in order to make that decisions, and we will let you know as soon as those decisions are made. Secondly, my position has been clear on Confederate monuments, that we should move them to a place with more historical context, moving them off the Capitol grounds into one of the Civil War battlefields. I do believe that monument is a good, that the budget had is a positive thing for our state. Certainly we want to help to try to find the money for such a thing, and we'll continue to work with the legislature to see if that can happen. Thanks. Next question, please.
Our next question is from Jonah Kaplan with ABC 11.
Governor Cooper, good afternoon. This is Jonah Kaplan with ABC 11. I want to know, please, what is the threshold for going or staying in phase 2 or even pivoting back to phase 1? Is it 2,000 cases a day, a 50% increase in cases? Is it a limit of ICU beds? And Dr. Cohen, the national headline that included North Carolina this week is the huge increase in cases each day. And today we know no exception. But by our math, we've seen cases up 24% in the last week, but we've also seen tests up 24% in the last week. Hospitalizations up only about 10%, so clearly we want cases to go the other direction. But is this increase in cases really that unexpected, seeing how we are doing so many more tests? So, thank you.
I'm going to let Dr. Cohen address that because they are looking at all of these trends and indicators, all 7 of them in combination, in order to make decisions about moving forward into a phase. And I'll let Dr. Cohen address that along with the second part of your question.
Hi, Jonah. Thanks for the question. And the governor is exactly right. That's why we have said all along, it can't be one metric in isolation that says, okay, yes or no, we can move forward, we can't move forward, because they all interplay with each other. You rightly, I think, were giving an analysis of the fact that we have ramped up testing a lot, which is good news. And so we are seeing more cases. The question is are we just seeing those more cases because of more testing, or are we also seeing a lot more viral spread? I think what we can see is that as you put together the number of cases that are increasing with the percent positive, which is also increasing, makes me have the conclusion that we are not just picking up cases because we're increasing testing, but also because we are seeing more viral spread. I think the hospitalization points us to that conclusion as well. We had been very stable of hospitalizations, around 550-ish people in the hospital day over day for many weeks. We're very stable. And really in the last 2 to 3 weeks, we've seen that go from the mid 500s to now over 800. That is a significant change. And again, tells me that that the virus is spreading more, because we know there's going to be a percentage of people who will become more seriously ill. So as more people become ill, that percentage of people who will need hospitalization goes up. So I think all of those in combination, more cases that we're finding through testing, percent positive going up, hospitalizations going up, I think those tell us in combination that we are seeing more virus in our communities. And I think you can see by the graphs I went through today that timing is very much linked to the last 2 to 3 weeks. It is very much linked to when we started reopening. And I think we knew that when you reopen and you move around more, the virus is going to move around more as well. So I think now it's upon us, every one of us in North Carolina, to say, how can I help keep the virus level low? And I've outlined those 3 things we need to do. One is the 3 W's, wearing the face mask every single time when you're out in a crowd, waiting 6 feet apart, washing hands. The second is getting tested if you've been to some of those high-risk places where you might have an exposure. And the third is picking up the phone to our local health departments in case you have been exposed and they want to tell you about next steps in terms of isolation and getting tested. So those are the things we can do right now, right? So we want to see those trends, right? We're increasing, but the question is how fast? And we have the ability to change the trajectory of those trends so that it doesn't go as fast. We can flatten the curve. Again, it's always that action to how can we flatten the curve as we go forward here. We've done it before. We can do it again. Thank you.
Thanks. Next question, please.
Follow-up from Jonah Kaplan, ABC 11.
Hello again. Thanks very much for taking this question. Dr. Cohen, just to follow up, that's the second time you've now mentioned we have flattened the curve. We can do it again. Does that mean the curve is not flat right now and we are going towards the peak that you have said we avoided? And for Governor Cooper, phase 2.5 or phase 3 could mean bigger crowds. We've seen the RNC is now moving, at least the celebration part of it, to Jacksonville, Florida, but the president also saying that he wants to hold a rally here in North Carolina. Have you had any contact with the president's campaign about North Carolina hosting such an event? Thanks.
Jonah, let me take your first question. And I think we saw in the data I presented today, if you saw the slope of that line, tells you how fast are we accelerating, and that does contribute to this flatten the curve. I do see a quickening of the pace or the steepness of that curve, which tells us we have work to do to flatten that curve out. And like I said, we have done that before. There are actions we can take to do it, and I'll turn it back over to the governor.
We are concerned when there are mass gatherings and large crowds because we see more viral spread when that occurs. I've not heard anything from the president's campaign about any rally in North Carolina. We'll check to see if any of our other agencies have heard anything about that, but I have not. Thanks. Next question, please.
Our next question is from Brian Anderson with the Associated Press.
Hi, Governor. Hi, Dr. Cohen. Brian Anderson here with the Associated Press. Thank you for taking my questions. I had one for the governor and one for Dr. Cohen. For the governor, you've talked about a phase 2.5, but I've also acknowledged there's the possibility the current second phase would need to be scaled back. So I was hoping you could just give me a straight answer on whether, on which direction you're leaning towards right now. Do you generally feel that things should be more open or more closed right now? Because it sounds like you're saying you have no intention of going backwards. So I just wanted a general direction of where you're going. And for Dr. Cohen, we have a pending request with your office for daily case data sorted by county. And I was also curious if you had an idea what the 6 counties were that Dr. Birx flagged. So if you could follow up with your staff and get back to us on that, we'd really appreciate it. But I just wanted to ask, are we in the middle of a second wave yet? Over the past week, have your fears of a second wave escalated? And those are my main questions right now. I see on your dashboard the ICU beds, the way it's represented has changed from like 13% to 22%. So if you or your staff could follow up on that as well, that would be great.
We are going to rely on our health experts who are reviewing this data, all 7 of these trends and indicators, making recommendations to us about whether we move to a 2.5 or a 3. No decisions have been made about that yet. These trends that we have been seeing the past week are concerning. And we think the public, the people of North Carolina, can play a significant role in our ability to get these numbers headed in the right direction. If people are careful, they wear their cloth face covering, they keep their social distance, they wash their hands. If our leaders across the state and people that others look up to will do those things, same things by example, it'll help us a lot. Because I'm going to say right now, the priority is getting our children in school in August, and we want to do that. We also want to continue taking steps to ease restrictions to reignite the economy, but we're not going to do that until our trends and indicators tell us that it's time to do that. And I'll turn it over to Dr. Cohen.
Thanks. There were a number of data questions in there, and we'll be sure to follow up on each one of them. But in terms of case counts by county, those are on our dashboard right now. We have them by county, by zip code, by per capita. We also just this week posted line level data as well. It's de-identified, but they're now spreadsheets of data if you want to look through them. So there's a lot of new information up on our dashboard. Again, trying to be as transparent as we can on how we we are looking at these numbers across our state. And so how today I try to synthesize that together for you to paint a picture of where I think our trends are going. And then, as the governor said, how we can truly impact them, because nothing is set in stone. These trends don't mean that our fate is sealed. It means that we have the ability to do actions ourselves right now that can change the trajectory of these curves. And that's what we want to make sure that we're doing, that we're warning everyone that the trends are heading in the wrong direction, but there are things that we can do now to make sure that we can get our kids back to school in August and do other things. Thanks.
Thank you. Next question, please.
Follow-up from Brian Anderson, Associated Press.
Sorry, just really quick for Dr. Cohen. Do you believe we're in the middle of a second wave right now? And over the past week, have your fears of a second wave escalated?
So I think this is our first wave. When I look at the numbers, we took early and aggressive action to flatten the curve, and we did that. We did it very successfully. And as I said, I think that was important and critical time that allowed us to build our capacity here in the state to respond to this crisis. But we did not see an early spike or a surge. And that was a good thing in our state. And I actually think this is our first experience at an increase at the beginning of that increase. And so that's why I think we all want to really be paying attention here, because I don't want to see a spike or a surge. There are things that we can do to prevent it. So this isn't a second wave. This for us is a first. And I think it reminds us that this virus is here, and we have to learn to live with this virus because we don't have a vaccine. We don't have a cure. And so this is a matter of how can we live with this virus so we don't see any spike, that we can keep the virus level low enough that we can go about doing things like opening our schools back up. So again, I don't think this is our second wave. I think this is our first, and it's a matter on us to make sure that we can live with this virus and make sure we don't overwhelm our healthcare system and we save lives. Thank you.
Thank you. Next question, please.
Our next question is from Brett Baldock with Fox 46.
Hi, Governor. This is Brett Baldock from Fox 46 Charlotte. As you know, South Carolina, has been opening at a much faster pace than North Carolina, and we here in Charlotte are right on the border, and our cases are spiking. Do you believe the case count in Charlotte because of what's happening in South Carolina? We've done stories, and we know people are traveling down there to eat, to do other things. And also, second question, did you ever have a conversation a month ago when everything was reopening with Henry McMaster about having the Carolinas open together instead of having these kind of two different states doing two different things?
Well, I'll let Dr. Cohen address that in a minute, but we know the virus does not respect state boundaries. And we know that when you have an area where people travel back and forth, that there is a potential to spread the virus. And South Carolina took a somewhat different approach from North Carolina and did ease restrictions more quickly. He and I discussed it. We did not discuss coordinating those efforts, but we did talk to each other about what each one of us was doing. And we remain concerned as these numbers go up. I'm not sure that I can tell you particularly where that Charlotte-Mecklenburg increase comes from. I do know that Charlotte-Mecklenburg has been a place of concern since almost the beginning. And I'm going to let Dr. Cohen address that point as well.
Thank you, sir. So yes, I would say all of our three urban areas, the Triad, the Triangle, and the Charlotte area, continue to be areas of focus for us. And it just means that when people live closer together, when it's more densely populated, there's more mass transit. It means there's more opportunity to spread the virus. So as the governor said, Charlotte's always been an area of focus, but I do think that as we are reopening and we know folks move around more, we know the virus will move around more. I think there are a number of things that drive our trends, and frankly, the increased testing that we need to do helps us identify where the virus is and try to understand how we can isolate it and make sure that folks who are sick, have COVID-19, do stay home. So I think it's a number of the things that we've been talking about that drive viral spread, whether it's someone who's in a high risk exposure through their job, like a grocery store or a child care center, or have attended a mass gathering. I think those are the things where we want folks to go get testing. But I think this is driven by a number of different factors, and our urban areas, because of their density, are certainly going to be more challenged. Thanks.
Next question, please.
Our next question is from Rebecca Martinez with WUNC.
Hello, Governor and Secretary. Thank you for taking my question. I'm Rebecca Martinez from WUNC. My question is for Dr. Cohen. Where is the DHHS and its plan to test every nursing home resident in the state, and what resources are being provided to facilities to carry out that testing?
Great. Thanks for the question. We've known that our nursing homes have been an incredible challenge through this pandemic. We know once the virus is in our nursing homes, it's incredibly hard to contain. It's why we've taken early and aggressive action to do a number of things across the board, from decreased visitation to make sure that we are having folks, if they see even one case of COVID-19, to test everyone. But we wanted to go further. We know we test when there's a case, but we wanted to say we need to take some proactive work to test everyone in long-term in nursing homes. And we are working with the nursing home associations and the folks that run each of those nursing homes on actually how do we make that happen. It is a big challenge to test everyone, and we're working through those challenges. We actually know testing the residents of the nursing home is more simple because they have insurance. Folks who are in our nursing homes are either covered by Medicare or Medicaid, and having insurance access really does help when we think about testing. But we know, unfortunately, the folks who work in our long-term care settings are more likely to be uninsured. We know that our state is only one of a dozen or so states that have not expanded Medicaid. We have a high uninsured rate here. And so it presents a significant challenge, not just logistically, like how do we get everyone tested? That's a big challenge. My team's working on it with the nursing homes, but also how do we make sure that folks get that coverage of their tests? So we're working through all of those challenges, and we want to make sure we're getting as much testing in the long-term care space as we can, again, because of the risks to the medically frail folks who live in our nursing homes. Thank you.
Thank you. Next question, please.
Follow-up, Rebecca Martinez, WUNC.
Thank you, Secretary. So to clarify, what resources are being provided to the facilities to carry out testing? I don't know if you're sending teams or if they're responsible to do that testing on their own. And my follow-up question is, what infrastructure is in place for residents who do test positive, especially if they don't have acute symptoms? Do they get sent to a hospital or a COVID-specific facility?
So the way we do testing is that it's some cases the nursing home is able to on their own. They contract with a company that will come in and do all of the testing for them. In other cases, that's not possible. We work with our local health departments to try to deploy teams. So that's how we've been doing it for the last number of months. And so when we hear about even just one case, again, an outbreak is 2 or more cases, but we said even one case, we make sure that teams go from the local health department to work with them, not just on testing, but on the infection protocols that are necessary for folks to make sure that they are working through this. So if someone does test positive for COVID-19 and they have no symptoms, they should stay in a nursing home. Again, in a nursing home, you have nursing care. It's actually that is a good thing that they have some medical support at the nursing home. We only want folks going to the hospital if they need hospital level care. But what we want folks to do, if they do find folks who are positive, is to cohort them, meaning that we want those who are positive to stay together, those who are negative to be separate from them so the virus doesn't spread. Make sure that the staff who helps those with COVID does not also work with the residents who don't have COVID. There's a number of infection control procedures. We have many guidelines on our website. We have teams of folks who've been working on this for quite extensively for a long time. So there's quite a lot of work that goes into what's happening in our nursing homes. We have reflected our payment levels in Medicaid to these nursing homes to reflect the fact that this work is hard. It takes resources. So there's a lot going on in the long-term care space that we've been working aggressively on. Thanks.
And you might have said this, Dr. Cohen, because I was talking to somebody, but we have been sending personal protective equipment to all of our nursing homes and rest homes to help them out with this situation, because you do need that to do testing as well. Next question, please.
Our final question today will be from Laura Leslie with WRAL.
All right. Hi there, Governor. Can you hear me?
Yes.
This is Laura Leslie from WRAL. Thanks for letting me ask a question. Actually, a couple of things. Number one, what percentage, since we're testing more now, what percentage of cases are coming out are people who are in congregate living settings, either prison, nursing homes, et cetera? What percentage of those cases overall? Perhaps Dr. Cohen can speak to that. And number two, so Wake, of course, is one of the counties that has had sort of a rising caseload. What guidance, if any, are you offering to our counties for measures that additional measures they might need to implement to try to control outbreaks on a county or local level?
I'll let Dr. Cohen take that.
Hi, Laura. I don't have the percentage off my top of my head, so let us get back to you on the percentage that are related to long-term care. There's a lot of information on our dashboard about the outbreaks, what we track every day, and how that relates to our cases. But as far as what would we advise Wake County, now we've been working closely with a number of counties, as we mentioned earlier in the week, that we are seeing faster increases in cases. And so our state team, the local health department within Wake County, and a number of partners around Wake County are really putting our heads together about how do we help make sure that we're getting ahead of things as much as possible. Key to that strategy is ramping up testing. I think testing helps us make sure folks know if they are positive, even when they don't have symptoms. So ramping up testing is very critical, as well as ramping up the tracing capacity. So we've been deploying additional tracers from our CCNC contract to our local health departments. I know Wake County has requested support for that purpose. So we work with them to say, how can we help you? Sometimes it's with testing, sometimes it's with tracing, sometimes it's with just digging into the numbers. But our local health departments really are the tip of the spear of doing a lot of this work, and it is hard work. And that's why we're trying to pull in as many partners. We want our health systems involved, the FQHCs, our other doctors and clinicians, and it's going to take a ton of partners and an all hands on deck approach to really get our arms around this and make sure we stay ahead of it. I think we're sharing these early warnings with you today about the trends that we're seeing. And if we can take an all hands on deck approach, it can't just be from state government, it can't just be from local government. It has to be really everyone working together, whether it's those individual actions, the business actions, the testing actions, the tracing, all of that is going to matter. And it's no one thing. We have to layer them all together and use all of those tools. So we're working with Wake County and many others on how can we layer those together, try to be as coordinated as possible. And when resources are needed from the state, we want to come in behind the local efforts and see where we can fill in gaps. Thank you.
That do it? We thank you all for joining us today. Stay safe and try to be careful this weekend. Do the 3 W's. Thank you.